¿Ya está listo? Ya, estamos al aire. So hello everybody. So today I want to show an hybrid technique and an edge way to use the axios to go inside the biliary tract when we have some kind of problems of dilations, for example, in cases like this one. This is a 37 years old woman with a history of past history of 20 years to have to had digestive bilioanastomosis because a complication of biliary tract surgery, a gallbladder surgery. So now it's coming because she have a lot of cholangitis, and what we saw here, necesito la imagen de la cholangiografía primero en grande. So what we saw that is that she had a very dilated biliary tract. I used the US to go inside the biliary tract and to perform a cholangiography, and that's what we have. Dile que ponga la imagen del colangiografía. No, está poniendo la del colangioscopio. So I will explain a little bit step by step what we can do here. So now I am here in the biliary tract inside with my needle already. So this biliary tract is really long size. So you can see here 90 millimeters, and the distance is good. It's 26. By my needle is just in even have 10 millimeters. So I'm not so far from the gastric wall. So and I am just a little bit down from the cardia. So in this case, what I would try to do is to use ALAMS, aluminum apposital metallic stent, to perform a bridge to go inside the biliary tract, and that's what I will try to do now. So I have my guide wire inside. It's not going down the guide wire, but I don't care about that because now the most important to me is stay inside with the guide wire. I will start to retire. Por favor, empuja. Wait, momento. So it's very important to see that to avoid complication now. So now the position is also very important, huh? And we need to have this situation very clear. You see now? So I recover my position. I said to my nurse to push the guide wire, and the guide wire is inside. So for me it's okay. And now I will try to pass my axios, my hot axios, to make the bridge, guided by US. Necesito la imagen ecográfica ahora. So I am far from the vessels. You see, my vessel is here, and I'm here. I'm going by this way, so it's okay. I'm sure that I am far from my vessels now. It's very important to have the good position and the vision, okay? So then I will use a hot axis now, 10 by 10 millimeter, because to use a small one for biliary tract is not good because of the distance. But I believe with the 10 millimeter I arrive to go inside the biliary tract and to make my bridge. Un momento. Yeah. So it's very important to see your guide wire. Where is the guide wire? Un momento. Tienes que tener bien la guía. So it's very important the help of your nurses. Now I lose my position. But I am looking. It's very important to see where is the guide wire. Now I'm better now. So now I am inside. And now I need to push a little bit. Tienes que tener la guía, si no, no avanzo. No la tengas ahí. Dame un segundo. So now I am trying to go like this way. La guía. So let's see. I'm perfect. I'm really perfect inside my biliary tract now. You see? It's there, it's open, it's here. So I see in the fluoroscopy that I am open, but I want to show you in the US. ¿Puedes ver la imagen de ecografía, por favor? You see here? My lamp is inside. So I'm perfect now. So when I am perfect, now I need to pull back. You see here? Like this. Ten aquí. Un poquito más arriba. Cuidado, no tanto. Ahí está bien, suelta. And now I will deliver my axios. So, and now I am perfect. It's coming. The bile is coming now. You see? That's perfect. So I will less my guide wire. Ok, retiro un poco la guía. Ok, ahora sí la podemos mandar bien. So I will less my guide wire inside because I want to go I will change the position a little bit. Okay, now change like that. Well, we will see. I will retire everything. And now I will pass a cholangioscope, a 9 French cholangioscope. see, I will perform first the dilation. Pásame la tapa. So now I will do a dilation to go inside until 10 millimeter. So I will see here. Necesito. Okay. Okay, so here's my lamps. And now let me see my position now. So I will try to go inside. ¿Cómo? Sí, pero no estoy insuflando. Let's see now. Let's see a little bit. I will push a little bit. I don't have good insufflation, probably it's for that. So no me insufla. A ver. Ponle más. So I'm sure that I'm inside the biliary tract now. I am trying to see my axios. Maybe I have to clean a little bit, huh? Let me see. Ven aquí. Va a ser una guía por el medio de esto. Okay, now So I try to see where is my axis here. So the axis is here. Okay, now I found it. I need to clean a little bit. It's okay. Where's my lamps? So the axis is here now. I have a good visualization now. Sí, pero con una guía dentro. No pasaron la guía. So now I will make a dilation, and then I will go inside with the cholangioscope, okay? So now, la guía. No, un momento. Retira. Okay, so empuja la guía. Empuja la guía, ¿sí? Okay, perfecto. So now I am passing my balloon. I'm okay here. I want to see the fluoroscopy. La fluoroscopía, por favor, dilata. So I need to perform a dilation until 10. You see, the biliary tract is already drained. So now we are performing a dilation now. Hasta 10 directo. Hasta 9. Hasta 9 ATM. ¿Ya estamos a 9? Okay, so perfect. Now, desinflamos. Dejemos la guía y pásame el cholangioscope. So I will deflate, and now I will pass the cholangioscope. And I will see what's happening here, if I can see the stenosis, and if I can... Empuja la guía. And if I can perform a dilation using the cholangioscope. There is a small pass. How are the level of bilirubin? Bilirubin, ¿a cuánto está? Wow, it's not so dilated. So probably there is a passing of bilis through anastomosis. So now I will pass a cholangioscope. So until we pass the cholangioscope, I am using a 9 French cholangioscope, high definition. Well, está detenida la imagen, ¿no? So, me gustaría tener la imagen de la colangioscopía. So now, I am inside the biliary tract. Okay, retira la guía. Now I am inside the biliary tract and I will try to find the right way. Floro. Okay. What I'm trying to do is to see there are some signs of cholangitis there. There are some areas of inflammation now. Now we are here. Oh, very well. So you see, now we pass inside the biliary tract, so it's a very dilated biliary tract. You see, this papilla is an inflammatory lesion because of the cholangitis that this patient have. This is in the classification published by my team is type 1 of benign lesions, so there's not something to be worried. And now I am going a little bit down to see if I can arrive to see the anastomosis with the small bowel and try to understand a little bit what is happening with this patient. You see the papilla here again. So here's the anastomosis, huh? Here is the anastomosis. So I don't see. So there is a stone, and look, this is anastomosis. It's really, you know, a stenosis. It's a big stenosis. So now what I will do is to pass a guide wire because try to do it this by fluoroscopy will be impossible. Okay, momento. So I'm still with a 9 French cholangioscope, so I can have some small chance. Okay. Yes, I pass. Empuja. Momento. Ten ahí. So this is very important because we need to do a dilation now. want to see very well where we are. So you see, without this technique, should be very difficult to arrive to do this. Empuja. So now I want to go inside. I will see if I arrive. I will arrive. Empuja la guía. So I'm trying to pass inside. Ok, vamos a pasar contraste. Solo quiero estar seguro. So I want to be sure that we are in the right position. Quiero agua. Contraste. No. No. Quiero agua. Son una llave de 3 vías. Conectas de un lado el contraste. So my maneuver, the maneuver here is a little bit difficult, but it's not impossible. Empuja la guía bien, ¿eh? No está abajo. Bien. It's really important that you have very, very well put it. Okay, now I will try to pass a balloon dilation, but I need to. Tonight. I think I pass. Yes, I pass. Yes. So now, you see, I'm sure that I'm in the anastomosis. Okay. Now I am in the anastomosis. I am sure that this is the problem that this patient have. So now we need to perform a dilation, and I will do that. I will perform a dilation because this anastomosis is a little bit different. So now where we are, I want to see where I am going now. Okay, so no. Un momento, empuja la guía. No pasa nada. O sea, ahora sí podemos meter contraste por aquí. I want to see where we are. So we are perfect. We are in the perfect way. Okay. So now I am in the small bowel. Empuja. I will make a dilation. Okay, empuja. With a balloon, 10 millimeter balloon. And then I will not put a stand for the moment because I want to see how it would work just with the dilation. I will recover this patient in 2 months to see how is the dilation. If the stenosis is okay, I will retire my axios and finish. That's all. But I will have this bridge, and it will recover from her cholangitis, and also she will recover it from the stenosis and the problem that she is having now. This could happen in this video digestive anastomosis. So I would like to invite you first to follow up in our live endoscopy channel, and second to join us during DDW this week in San Diego. So we have a lot of new research that will be present in oral presentation and posters. Um, Join me Saturday. I would talk. I will give a lecture for as a speaker how to interpret the cholangioscopy image. Um, so I am very glad and honored to have been invited. But also this year DDW will have live transmission cases from 15 centers around the world. So we are one of the centers that we will show with new technologies, AI technologies for cholangioscopy during live procedures. We will show also therapeutics regarding varices and more. So join us Monday 4 p.m. and also Saturday 4 p.m. So now I have my balloon in the stenosis, and I will try to, well, I will make a dilation. Primero hasta 5.5, por favor. So you see now it's good. Hasta 10. Yes. Okay. So I perform a dilation until 10. It passed very well. Puja. Y desinfla. Desinfla. So the stones goes out, you see? It's good. Empuja. So now I will pass my cholangioscope to see, and I believe we finish. So this is a new proposal that we are doing to deal with this kind of benign stenosis. That is a late complication of biliary surgery. That's right, Luis? Okay. It happens sometimes. So now, I will pass my cholangioscope and I will finish the live transmission from today. So, quiero la imagen del cholangioscopio. La imagen del cholangioscopio. No, del cholangioscopio. So now we are in the anastomosis. I want to see very well where is my anastomosis. So I believe it's here. No, 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 no empujes. Ya, retira. Ten, ten. So let me see. I don't know why I'm not passing. Moment. So we're here. Huh? It's good. It's okay. Huh? So this is anastomosis. This is the stenosis and was well dilated. So we're very good now. So now you see. Now we see very well. So it was very good dilation. There is no perforation. You see, we don't see any contrast outside of the bowel. So I will lace like that. I will not put any stent for a moment. Now I am in this small bowel. It's okay, small bleeding, but so we delayed the stenosis, and I believe this patient will going well. So I will finish now my procedure. Thank you so much for joining us today, and we will see the follow-up in 2 months of this patient.